Hello, I'm Patrick DeHere from the APMA Board of Trustees. As the spring season approaches us and children become more active outdoors with sports like soccer and baseball, a very common pediatric foot complaint is Sever's disease. Sever's disease is inflammation of the growth plate and the heel bone. It often presents as pain worse with activity and typically presents in children between 8 and 12 years of age. The diagnosis of Sever's disease is a clinical diagnosis more than a radiologic diagnosis. Oftentimes x-rays are used to rule out any other type of pathology, but really the key to diagnosing the condition of Sever's disease is pain with side-to-side compression of the heel and pain when standing barefoot on one foot. The treatment for Sever's disease is multifactorial, with the ultimate goal is allowing the children to continue to participate in the sports that they are playing. One thing that has been shown with research is that Sever's disease does negatively affect children's quality of life. Treatment typically involves reducing inflammation with something like oral steroids or anti-inflammatory medication, stretching of the calf muscle, reducing shock to the growth plate with a soft heel cup and/or orthotics. With lack of response to conservative treatment, sometimes reduction in activity level is required, such as immobilization with a walking boot. But typically, Sever's disease is a self-limiting pathology. If your child is experiencing heel pain and it's not responding to typical over-the-counter anti-inflammatory medicine, rest, ice, and activity reduction, please see your local podiatrist.